Good morning, everyone. Happy Tuesday to you. As always, your host, Dr. Steven Zom, here, bringing you another episode of Tooth Teacher Tuesday. Today's topic, kind of diving into what I hope will, branch off into several follow-up videos, but questions kind of related to clenching and grinding of our teeth. What are some signs that I feel like I might be clenching, grinding my teeth, but I'm really not sure. So, what are some signs that we as your dentists are looking at to determine if you have some kind of um, clenching or grinding disorder? Um, I would say probably the most common thing that we see is actually seeing flat, worn spots on our teeth, especially the back teeth. Um, you think of our back teeth are supposed to have the little bumps, the cusps that give us good surface area to chew with. And for someone who's clenching or especially grinding their back teeth, those bumps are going to start to get worn kind of flat. And so we see the back teeth especially looking very flat compared to their natural kind of bumpy appearance. Um, Another common symptom that we would see with that is some kind of TMJ disorder where either, the jaw joints themselves are sore or tense, or the chewing muscles related to our jaws, in our cheeks or up in our temples, um, those muscles are tense and sore, and um, especially a lot of that being at nighttime, that patients report waking up and just feeling like they've got a headache, or feeling like their jaw's sore, like somebody popped them in the jaw in the middle of the night. Um, and then also too, just you know physical signs that we can actually detect as dentists of actual popping or grinding sounds in the jaw joints, or seeing limited movement with the jaw joints, or even the jaws locking up altogether. Um, Again, those can be signs that certainly during the daytime it's possible, but more often than not at night, there's some clenching and grinding going on that we're not even aware of. Um, and thus, you know, we're having these symptoms in the morning. Um, and then another, common symptom that tells us we might have a clenching or grinding issue is that we're constantly seeing either teeth themselves or fillings that just keep breaking or cracking or chipping, seemingly out of nowhere. Obviously, our teeth aren't indestructible, and neither are fillings or crowns, but they certainly can take a lot of force. And so if we're seeing areas where they just constantly keep chipping, even though they really shouldn't be, that's a sign that we're putting a lot of force on those teeth, and a lot of times that's due to a clenching or grinding habit. Um, and so those are some things that we as dentists are looking for. And I guess to piggyback on that, one other common sign is seeing recession along the gum lines. Seeing the gum start to recede, that can also be a sign that we're clenching so tight that it's putting so much force on the teeth that the gums are actually receding in response to that force. Um, so yeah, a myriad of different symptoms that, on their own could be just their own thing, but when we start seeing these symptoms together, a lot of times that's when we're thinking, okay, we've got some kind of clenching or grinding disorder, and then start talking treatment options. And again, certainly most times that clenching or grinding is happening in the nighttime. I know some of us can catch ourselves clenching or grinding during the day, especially if we're at work or at school and stressed out about something, we might catch ourselves kind of tensed up. Um, but a lot of times this is happening at night, and it's no coincidence at night. You know, certainly some of us can take our stress to bed with us, and um, but part of it too is a lot of times a clenching or grinding disorder is a sign of an overall bigger issue, which we've mentioned in the past, and I hope to talk about more in future videos. Um, a sign of sleep apnea, where the airway is obstructed at night. You know, I think a lot of us think of sleep apnea as just being snoring, but that's not the only symptom. If we're seeing a clenching or grinding disorder at nighttime, a lot of times that's because that airway is collapsing at night. We're not getting enough air, and in response to that, our subconscious brain is trying to open that airway up so we get enough air at night. And one way our brain tries to accomplish that is to shift and grind our teeth around at night, and you know, without even realizing it, we're doing damage to our teeth and putting that pressure on our chewing muscles and on our jaw joints, and all of that just because we're not getting enough air, and our jaw is trying to open itself, shift itself into a position where we do get enough air. And so certainly one common treatment for nighttime clenching and grinding is to create an appliance that's called a night guard. It, as you would almost think of like a athletic guard that you'd wear playing sports, but it's similar appliance designed to take that pressure off our teeth and off our jaw joints at nighttime. And so a lot of times that can be all the treatment that's necessary for a clenching or grinding disorder. But again, if that clenching or grinding is occurring due to an overall bigger issue of sleep apnea, then you know that night guard's only going to go so far, and more than likely future treatment's going to be needed. And so again, that's more of a topic for a future episode, kind of talking about how that all ties into dentistry with sleep apnea. But to circle back to our main topic, that's some signs and symptoms that we have a clenching or grinding disorder, and what we look for as dentists, and what we can do to treat it as your dentist. And so hope this information was useful for you, and if you are suspicious that you may have some kind of clenching or grinding disorder, as always, consult with your dentist, see what they think, and then they can kind of direct you from there. But in the meantime, I want to thank you for your time and attention today, and I hope you will join me next Tuesday for another episode of Tooth Teacher Tuesday. Until then, have a great week.